Well, the highlights of the meeting, I always try to, also as president, I look at the program with the scientific committee, and there's one thing we choose with scrutiny, is the presidential sessions. Our level of scrutiny deals, of course, with the quality of the data, but with one definition mainly, is it has to change the practice. The practice is how you do something or how you decide not to do something. It can be negative trials sometimes, or maybe also the way you perceive, anticipate, apprehend your environment, right? But basically it has to change the way you do, the way you are and the way you do. So if you ask me about the highlights, the answer is go to the 3 presidential sessions, because all of this data has to be borrowed back home and used, right, as soon as possible. But yesterday at the presidential, we were able to see 3 abstracts which were phenomenal, wonderful. The first one was about how pollution can create cancer in never smokers. Really arguing about the mechanism, first of all the epidemiology, why is it different from one country to the other one depending on the pollution, and the pollution is the reason why the cancers develop. And the second thing is what's the mechanistics, the biology behind, and the third thing is how can we imagine to prevent that or act on that beyond, of course, the environment management that we urgently have to deal with, right? The protection of the environment. So a wonderful abstract creating an amazing, I would say, noise, an amazing impact internationally. And I liked Charlie Swanton, the way he was describing. He will probably not tell it to you when you will interview him. He had this social consideration, right? Because he was telling even if smoking is a way higher risk factor, maybe 15 times more, you cannot choose the level of pollution you are exposed to. And interestingly, the highest level of pollution are most of the time found in places where the poorest people live. So that's really important to keep it in mind, right? There's something to change, and the diversity is a topic to keep in mind. So that was a very good one. And the other 2 abstracts of the presidential were wonderful because they were changing paradigm. One is about rare disease, desmoid tumor, with a perfectly new class of compound, and the other one is immunotherapy high level. It's melanoma, and we use T-cell therapy. So you take TILs, tumor-infiltrating lymphocytes, you dissect the tumor, take the lymphocytes, grow them, give chemo to the patient and refuse them, and you use them as weapons, as an army against the cancer. And they compared it to ipilimumab in second line, and it was way better than ipilimumab in terms of progression-free survival. And that's the first time you have randomized data, particularly here it's produced in Europe, that shows that this still T-cell therapy, engineering T-cells, right, might be a way to treat tumor in the future. We know it from hematological malignancy, CAR T-cells, but it's a different strategy and it's solid tumors, it's melanoma. So this was really an amazing kind of new concept.